Good day. My name is Lady Sarah Cadano, and I am here to discuss my FMA2 for Communication, Social Marketing, and Mobilization. So, social mobilization and social marketing are helpful strategies used in communities to raise awareness, encourage behavior change, and involve people in solving local problems. These can be used for different issues like waste, education, safety, or youth concerns. To know if a program is effective, we need a simple way to plan and evaluate it. This framework is also designed to help community workers, students, or organizations to evaluate a certain programs. It makes sure that the program is based on the real needs, involves the right people, sends the right message, and lead to positive change. So, in many communities, problems remain unsolved not because people don't care, but because there's a lack of awareness, participation, or organized action. Social marketing focuses on creating messages and materials that inform and inspire behavior change, while social mobilization brings people together through activities, campaigns, and shared efforts. By combining both strategies and evaluating them through a simple framework, communities can better organize their programs, involve more people, and measure if they are making a real difference. So, this framework is also uh, focused on my FMA1 topic, which is ating dibdibin program. So, the first one would be objectives. So we have to evaluate the program performance, guide improvements, and inform planning. So as per my topic for ating dibdibin program, we have to evaluate if there is an increasing detection of breast cancer in Taguig. And then the second is we have to evaluate criteria. Identify who is affected or who should be involved. Would it be the youth, parents, or would it be the barangays? We have to look how effective the program has been in detecting breast cancer early, which is key to improving outcomes. Also, evaluate the program is if it's using its resources like time, money, or staff effectively. Also, we have to determine the key questions. List all the people or groups who can help, like leaders, schools, NGOs, or volunteers. By doing this, it will help assess the effectiveness of the program. It and it also contributed to lower breast cancer mortality rates or better health outcomes. Questions are like how many people were served, were the participants satisfied with the program. The next one would be indicators. So these are measurable elements that allows us to track the progress and success of the program. Sample are number of screenings, number of early detections for breast cancer. The next one would be the data collection methods. They are surveys, interviews, health records, and program reports. We can review the medical data and statistics to track screenings, diagnosis, and treatments. We also have to review of internal program for documents such as attendance logs, budget reports, and performance metrics so we can measure its effectiveness. And who are the responsible team? So this refers to the group of individuals or organizations that are responsible for implementing, monitoring, and evaluating Ating Dibdibin program. The team ensures that the program runs smoothly, meets its goals, and that evaluation process is carried out effectively. My last one would be reporting and use. Look at what changed and ask the community for feedback. What worked and what can be improved. The evaluation results will be shared with the city government officials to assess the program's performance and justify future funding, maybe, and identify the successful tactics so that it can be applied in the future projects or enhance the projects. So we can conclude that the programs are successful if it meets the objectives, demonstrates positive outcomes in key areas, show continuous improvement based on data, or is supported by a responsive and coordinated team. So, by following these simple steps, community leaders, organizations, and volunteers can make a lasting impact and improve their communities through participation, awareness, and action. Thank you so much for listening.